Hello, I'm Dr. Donald John Babu. I'm a cancer surgeon, a robotic surgeon, and a laser surgeon working at Reliance Hospital, New Bombay. Today, we'll be discussing head and neck surgeries, head and neck cancers. So, what are head and neck cancers? We divide head and neck cancers into 5 or 6 categories. The most common cancer among the males in India is the oral cancer. The oral cavity includes the lip, the jawbone, the cheek or the buccal mucosa, the tongue, the upper roof or the palate. Head and neck cancers also includes the nasopharynx, which is the tube behind the nose, the oropharynx that connects the tube, the mouth to the esophagus or the food pipe, and is also a connection between the nasopharynx and the oral cavity. Head and neck cancers also include the tumors of the voice box, which is mainly the larynx and the pharynx. The pharynx is the connecting part or the topmost part of the food pipe, which connects the oropharynx, nasopharynx to the food pipe. So we have tumors of the vocal cord or the voice box, which is the larynx and the pharynx. Head and neck cancers also include tumors of the salivary gland. There are 3 salivary glands, or rather I should say 4. One is the parotid, which is right below the ear. Second is the submandibular gland. Third are the sublingual glands below your tongue. And the fourth are all those small minor salivary glands situated all across the mouth. So you have tumors arising from the salivary glands as well. A 5th category is the thyroid or the parathyroid tumors. I would keep that aside for today. So most of these head and neck cancers, the cancers of the oral cavity, nasopharynx, oropharynx, hypopharynx, and the salivary tumors have a common etiological factor, which is the smoke or the tobacco. People in India have this culture of eating or chewing tobacco. Tobacco has various forms. In India, it could be in terms of pan, local language could be mishri, it could be just a slaked lime. They just roll it on the betel leaf, put it in their mouth, keep it for a long time. It's an irritant, causes inflammation, it causes multiple minor traumas in the mouth. Because of this trauma, there is a continuous correction of the wound. Invariably, what happens is one of these corrections, they turn malignant. It is uncontrollable growth of this tissue that causes the cancer. Most of the times, the correction of the wound causes healing of the wound. But in this particular instance, because of the continuous correction, somewhere something goes wrong and there is an irregular buildup of tissue which is uncontrollable by the body, which is the reason for the cancer. Oral malignancies have, today we found out, have other causes as well, which is the human papilloma virus. The human papilloma virus is the most common cause of head and neck cancers in the West. How does human papilloma virus spread? It can spread through breast milk. It can spread through sexual contact, poor oral hygiene. Today we have vaccines for human papilloma virus, and we advise all mothers to inoculate their children between the age of 9 and 26. This human papilloma virus also causes other cancers like cervical cancer, warts, anal cancers, penile cancers, warts around the nipple areolar complex as well. There are other causes as well for oral malignancies. Conventionally, they were termed as the 6 S's. 1 S for smoke, which I've discussed. Second is a spirit, which is alcohol. Third is sharp teeth, which is also a very common cause. The constant rubbing of teeth on the tongue can cause tongue cancers, or for that matter, even buccal mucosa cancers. The 4th S are these syndromes, very rare conditions like xeroderma, pigmentosa, dyskeratosis congenita. These syndromes can cause cancers as well. The fifth S is sexually transmitted diseases. I've already mentioned about the human papillomavirus. Others are HIV. And sixth is sepsis, or some kind of infection, chronic infection like candidiosis or other malignancy or other kinds of infection can also cause cancers. But today, the most common cause of oral malignancies or head and neck cancers in general is alcohol and tobacco. The nasopharynx particularly is infected by the EBV. Nasopharyngeal cancers are very common in the northeast, very common in the Mongoloid population, and this is basically caused by a virus called as the Epstein-Barr virus. Other tumors, that is mainly the oropharynx, the hypopharynx, the salivary gland tumors, are mainly caused by tobacco, alcohol. There are a few cases that can just arise de novo. There is no particular cause, and it could be just simply retention of the mucus in the salivary gland, etc., causing to for the salivary gland tumor to arise. Now that we know about the causes of head and neck cancers, once the patient comes to us, what do we do? How do we investigate? First, we need a biopsy to confirm our diagnosis. Generally, oral malignancies are a no-brainer. When you see them, you know it's a cancer. However, we do take a biopsy to confirm our diagnosis. The biopsy can be subjected to some kind of immunohistochemistry to know if it is human papillomavirus related or tobacco related. If it is virus related, the cancers have a better survival rate. Once we have a confirmed biopsy, we can go for a whole body scan like a PET scan or a CT scan of the same. An MRI will be helpful if you want to know soft tissue delineation, to know how much the tumor has spread, but a CT scan is good enough. Now that we have come to the diagnosis and the investigations, we come to the treatment. The treatment of head and neck cancers, the oral cancers, is mainly surgery, which can be consolidated by chemo and radiotherapy. The problem with the tumors in the nasopharynx, the oropharynx, and the hypopharynx, the main problem is surgery can be very devastating. It is the removing of the entire face, the tube. A plastic surgery will be required. Hence, we subject these tumors mainly to radiation and chemo. And surgery is left only for those residual cancers that do not respond to the same. We also have immunotherapy if patients do not respond to the first and second line of therapy. In a nutshell, we have 5 main subsets of head and neck cancers: the oral cavity cancers, the nasopharynx, oropharynx, hypopharynx, salivary gland tumors. Thyroid and parathyroid tumors can be discussed on another day. The main causes are mainly tobacco and tobacco related stuff, alcohol, which is a spirit, sharp tooth, poor oral hygiene, sexually transmitted diseases. These are the causes. How do you investigate? With a biopsy and a CT scan, sometimes even an MRI. PET scan is just as good. Treatment for oral malignancies is mainly surgery with adjuvant chemo and radiation, and for the other, even for the salivary gland tumors, it's mainly surgery. But for the oropharynx, nasopharynx, and the hypopharynx, it's mainly chemotherapy and radiation. We also have immunotherapy for the metastatic patients. Thank you.